everyone, we will be discussing a tuberculosis disease applying the environmental theory. Florence Nightingale environmental theory focuses on the impact of the environment on the health and well-being of individuals. This theory can be effectively applied to the treatment of tuberculosis, a highly contagious and patiently deadly respiratory disease. This report aims to outline how Nightingale environmental theory can be employed to provide a conducive environment for managing and treating tuberculosis.
My name is Jordana Micaela de los Santos and I will discuss tuberculosis. So what is tuberculosis? Tuberculosis or TB is an infectious disease that most often affects the lungs. It's caused by a type of bacteria. It spreads through the air when infected people with cough, sneeze, or spit. TB is preventable and curable.
Tuberculosis is caused by a bacterium called Mycobacterium. Tuberculosis people with active TB disease in the lungs of voice box can spread the disease. They can release tiny droplets that carry the bacteria through the air. This can happen when they are speaking, singing, laughing. The general symptoms of TB disease include feeling of sickness or weakness, weight loss, fever, and night sweat of the symptoms of TB disease. The lungs also include coughing up of the blood. Symptoms of the body depend on the area affected.
I'm Erica Rosie Paraiso, and now let's discuss the application of Florence Nightingale's environmental theory for the treatment of tuberculosis. First, we have ventilation and fresh air. Nightingale emphasizes the importance of proper ventilation and fresh air in maintaining a healthy environment. This principle is particularly relevant in tuberculosis treatment, as fresh air helps prevent the spread of the disease. Treatment facilities should be well ventilated, allowing for the circulation of fresh, clean air to minimize the risk of transmitting the infection. So yun po, fresh air po is very important, hindi lang po sa sakit na tuberculosis, kung hindi po sa lahat ng sakit. So dapat po every morning binubuksan natin yung mga bintana ng treatment facilities or yung facilities kung nasan yung ating patient na may tuberculosis. Nang sa gayon ay ma-minimize natin yung risk of transmitting the infection, and yung fresh air din po nakakatulong upang ma-prevent yung pag-spread ng mga iba't ibang disease. Next, we have light. Light plays a crucial role in the recovery process, and Nightingale emphasizes the need for natural light. Adequate exposure to sunlight helps in reducing the transmission of tuberculosis and also aids in the synthesis of vitamin D, vital for strengthening the immune system. Treatment facilities should be designed to maximize natural light, ensuring patients have access to sunlight during the day. So, dapat din po, every morning nilalabas natin yung mga pasyente natin na may tuberculosis para magpaaraw. Nang sa gayon po is ma-absorb nila yung mga vitamins or sustansya na meron yung sunlight. Dahil alam naman po natin ang sunlight or natural light ay may iba't ibang hatid na nutrients or vitamins sa ating katawan. Katulad na lang ng vitamin C or vitamin D na nakakatulong upang mapalakas natin yung immune system ng ating pasyente. And nakakatulong din po ito na mapatay yung bacteria na nasa tuberculosis na meron po yung ating pasyente. Next, noise control. Nightingale advocates for maintaining a noise-free environment to promote healing and rest. In the case of tuberculosis treatment, peace and quiet are essential for patients' recovery. Keeping noise level to a minimum in treatment facilities can aid in reducing stress levels, enhancing the healing process, and allowing patients to rest adequately. Noise control. Ano nga po ba yung noise control? Noise control is dapat minimize natin yung mga ingay na nagagawa sa loob ng treatment facilities kung nasaan yung ating pasyente is nagpapahinga and nagpapagaling. At para iwas stress na rin po sa ating mga patient, dapat lagi nating nami-maintain yung quiet atmosphere sa loob ng treatment facilities na kailangan ng ating mga pasyente para magkaroon ng maayos na pahinga at mabilis na pag-recover sa kanilang mga sakit.
Number 4. Sanitation and cleanliness. Proper hygiene and cleanliness are fundamental in preventing the spread of tuberculosis. Nightingale emphasizes maintaining a clean environment to minimize the risk of infections, ensuring the regular cleaning and disinfection of treatment facilities including in surfaces, bedding, and medical equipment is crucial in controlling the transmission of tuberculosis. Cleanliness is essential for every healthcare setting. The healthcare industry is tasked with protecting the health of millions of people every day. Part of maintaining patients' well-being is protecting them from bacteria that may be present in facility that provides medical treatment. We must know that cleanliness is a top tier. When you maintain cleanliness, you can prevent disease and lead a healthy life. Number 5. Comfort. Comfort plays a vital role in the recovery process. Nightingale emphasized the importance of ensuring patients' comfort during treatment. In tuberculosis management, providing comfortable bedding, proper furniture, and soothing environment help patients cope with the physical and emotional challenge of the disease. If patients are comfortable, they are likely to recover quicker and better health outcomes. A negative environment delays healing. When patients experience too much anxiety, they don't recover as easily. An increase in stress hormones like cortisol can lengthen illness. This is because prolonged stress hormones affect the nervous and immune systems. Not only does it make them more inefficient, but it can also overstimulate the body immunity and trigger autoimmune disease. So when patients are more comfortable, they are more likely to have better healing and can recover faster. Personal space. Respecting patients' privacy and providing them with personal space are essential principles of Nightingale's theory. Tuberculosis patients should have adequate personal space to rest, recover, and minimize the risk of spreading infections. Designing treatment facilities with private areas for individual patients is crucial in following this principle. Personal care helps maintain a person's dignity, health, and well-being. Good hygiene and personal care reduces the risk of infections and illness. It can also prevent pre-existing conditions from getting worse. Assisting patients with basic hygiene not only creates a personal connection between the healthcare provider and patients but also is vital to maintaining the patient's health.
7. Nutrition. Good nutrition is crucial in strengthening the immune system, aiding in recovery and preventing further complications from tuberculosis. Nightingale's theory emphasized the importance of providing patients with a balanced and nutritious diet. Tuberculosis treatment facilities should offer healthy and well-balanced meals to optimize patient immune response. Sabi nga dito, nutrition means getting the food and nourishment that you need for health and growth. Yes. Syempre, without nutrition, we grow sick, and at the very worst, we can even. Number 8. Psychological support. Nightingale highlights the significance of psychological well-being in the healing process. Tuberculosis patients undergo emotional stress and anxiety, making psychological support essential. Establishing counseling services and support groups within treatment facilities can help patients cope with the psychological challenges of the disease. Syempre, kailangan ng patient na magkaroon ng support system because having a support system has always been proven to reduce anxiety, depression, and stress. In order for us to thrive, we need a support system to be there for us when we are in need. Number 9. Communication. Effective communication among healthcare professionals, patients, and their families is essential. Nightingale upholds the value of clear and open communication in promoting trust, understanding, and cooperation. In tuberculosis treatment, clear communication about the disease treatment plans and expectation can enhance patient compliance and the overall treatment outcomes. Of course, we need to communicate about what we feel in our body because it will help us to know what to do to cure or to prevent it, and also help us to develop a sense of trust between the patient, which might make it easier for the patient to adhere their recommendations.
Let's proceed with education and health promotion. Nightingale emphasizes the need for education and health promotion to prevent the spread of disease. In the case of tuberculosis, educating patients and the general population about the disease, its transmission, prevention measures, and the treatment protocols are essential. This empowers individuals to make informed decisions regarding their health and contributes to the control of tuberculosis.
As an individual, we should learn about things, most especially about health, to maintain our body strong away from illness. In this case, we knew how diseases prevent and how can avoid it. That's why education and health promotion are important. Kumbaga, kapag may knowledge na tayo about health promotion, malalaman natin agad yung dapat unang gawin kapag may mga symptoms na tayong nararamdaman. Lastly, collaboration and innovation. Nightingale's theory promotes collaboration and innovation in healthcare. Tuberculosis treatment is often multidisciplinary efforts involving doctors, nurses, health public officials, research, and policymakers. Collaboration and innovation in terms of research, treatment protocols, and preventive strategies are essential to effectively combat tuberculosis. So dito naman, we need a collaboration to easily cure one's disease. Since hindi lang naman doctors at nurses yung nag-a-assist ng patient, but all of the medical staffs, including the pharmacists. Since sila yung nagpo-provide ng mga medicines, most especially yung family natin. We need a collaborative with them. Since sila yung isa sa mga nagpapalakas ng loob ng mga patient, which is very helpful to easily recover. Through collaboration in others' healthcare, magkakaroon tayo ng much more knowledge about diseases or preventive strategies.